Hi folks, I'm Sam Lasant and I'm here at the Simon Kramer Institute in New Philadelphia with my very good friend Dr. David Moylan. Now folks, before we start this program, I want to tell you, this is a show that I think you are going to find extremely educational, and it's something that I think you should have your friends and relatives listen to it. Now you do know you can watch this show anytime, 24/7 on our website at ssptv.com. As we get into this show, you'll know why this is a very important show for you to listen to. But first, let me thank you for allowing me to come once again to beautiful institute.
Thank you for being here.
You're the founder of the Simon Kramer Institute, Doctor, right?
Yes, I am.
A brief description of what you do here.
Well, going back to the founding, since 1998, we have functioned as a multidisciplinary cancer institute for the purpose of caring for patients with that dread disease in both, in the anthracite region, mainly Carbon and Schuylkill counties. We're located in New Philadelphia, about 6 miles from Pottsville. And the name, as you know, is to honor one of my professors, Dr. Simon Kramer, who was one of the key radiation oncologists in the field, founded the Department of Radiation Oncology at Jefferson Medical College in Philadelphia.
Why is it so important to have a cancer screening, and who is eligible, and how do you about doing it?
Well, certainly there's many common cancers that plague people in our region. There's been scientific proof that screening has cut down on cancer deaths in diseases such as breast cancer, cervical cancer, and colon cancer. Nowadays, we see patients in the very earliest stage when you can't even feel a lump in the prostate on the digital rectal exam. The cure rates are in excess of 80%. So I think this will be a throwback if our physicians abandon the ordering of routine PSA testing. The other form of cancer that has been a bit controversial in the benefits of screening has been lung cancer, and it is so common, particularly in our region where we have an excess of cigarette smokers. But in the United States, in the year 2010, it's been estimated that 225,000 people will be diagnosed with lung cancer. It's almost 250,000. And unfortunately, even with the best surgery, the best radiation, the best chemotherapy, the cure rate is a paltry 15%. And in the same year, 2010, it was estimated that about 157,000 people will die. So unfortunately, most of the people are not cured of their lung cancer. However, 15% across the board cure rate. In the early stages, 1, 2, the cure rate is as high as 80%. So that is our goal. And we do have some information in the scientific literature that supports screening. Now, the screenings in the past just consisted of routine chest x-rays. And unfortunately, a routine chest x-ray once a year is not sufficient to pick up enough early stage cancers. But in the 1990s, technology in the form of the spiral CAT scan, this was developed, and now we're seeing patients detected in that important stage 1. So this information was published from the National Lung Screening Trial in the New England Journal. I once said, Sam, that getting an article in the New England Journal is the equivalent of getting your face on the cover of the Rolling Stone magazine.
Okay,
so this was a very important milestone, and that was the first time that it was demonstrated that the cure rate could be improved by 20% versus regular chest x-rays.
So knowing the importance of cancer screening is, and we're looking at probably ages 55 plus, okay? Is that an area where we...
Yes, there is potential harm that could be done by screening everyone, because it would be a very low yield. but by focusing on the high-risk group, and by that we mean the age from 55 to about 74. That was what the National Lung Trial looked at.
Okay, so being in that age group right now, there's considerably a number of us in northeastern and central Pennsylvania. Okay, so but now, if you are a cigarette smoker, or you had worked in areas where there was dust or whatever, or perfume or fumes or whatever, it would be advantageous for them to look into getting a lung screening. Is that correct?
Absolutely, and we want to launch this program in this spring, and we will be interviewing patients in that age group, and we will be taking detailed smoking history.
Okay.
The magic number that was used in the study that was published in the New England Journal was 30 pack years. So that could be somebody who smoked 1 pack a day for 30 years, or a half a pack a day for 60 years, or 2 packs a day for just 15 years.
Okay.
And they're the group that we would like to screen.
So I'm interested in at least finding out, what is this test? Is it a test that is, explain how the test goes. What is it?
Well, it's going to be a series of tests. First, the physical examination by myself, emphasizing the lungs, any lymph nodes draining the lungs. Number 2, a breathing test, simple breathing test blown into a tube, and this would see if there's damage to the lungs. If there is damage to the lungs, that's another high-risk group. If basically the smoke goes in there and it gets trapped in the lungs, it dwells in there, and the carcinogen increases the risk of lung cancer. So that would be another group we would look at for screening. And then a helical CAT scan will be done of the chest, and we have that device right here at the Institute. It only takes about 7 to 15 seconds to scan the chest. Right. The patient would hold their breath for a short period of time, and the scan would be done.
Right. So we have the technology that you have, and you have a team also. You have a comprehensive team that you're working with as well, right?
Yes. Over the years, I've developed what I call go-to people, and we have a very experienced thoracic oncologic surgeon, and Dr. Herbert Hoover, Dr. Mark Caliendo, who is an interventional radiologist, because indeed, if we do find a nodule on these scans, we have to go further and find out what it is that nodule. And then finally, my better half, Dr. Denise Moylan, who is a board-certified lung specialist, and she will be part of the team interpreting the breathing tests.
In terms of educating the public, which we're trying to do today, Dr. Moylan, it's imperative for people to get the screening as early as possible. We know that. It's been told to us a number of times. If they come in for the screening and there is something starting and it's only stage 1, we understand there's about an 80% survival rate here.
Absolutely.
Okay, so it would be really foolish for anybody who has smoked, who has been in situations, okay, not to take advantages. As we're speaking, folks, the Simon Kramer number is on the screen, and you can get any information you want from that, as well as additional information that you would require from them. They'll be more than happy to give that to you. But this initiative, I think, is really something that's ahead of its time. It's something that's been going, that really is starting in the country today, and you guys are a leader in this.
Well, the science is there, and through our foundation, we're making this a low-cost effort available to the patients of the Cole region.
Well, all I could say, Doctor, is as I know that there are many people out there, many lives can be saved if they just would do early screening and early testing. And like I said, I'm one of those people, but I'm going for my colonoscopy. I'm going for the different tests that have to be done, and hopefully everything will be fine. But if there is something, at least you got it at early stages. We're here at the Simon Kramer Institute. Numbers on the screen. Any information you need, it's very important that you consider it. After all, it's your life. Thank you for joining us.